Hi, welcome to Module 1, Research, Evidence-Based Practice, and QI. How do they apply to nursing? I'm Liz Carlson.
And I'm Beth Staffolino. The use of research, evidence-based practice, and quality improvement are being advocated to ensure best practices for our patients and also to improve patient outcomes. But it's often challenging to understand the differences between these initiatives and how to integrate them into our daily practice. While these initiatives do have distinct purposes, they are not mutually exclusive. In other words, it doesn't mean that there isn't an overlap of key characteristics. However, the outcome may differ. So what are the differences? We're going to talk about each of these initiatives separately in an overview, but just to mention that research brings new knowledge, evidence-based practice changes practice, and quality improvement is really looking to improve processes.
So, what is research? Research is a foundational component for evidence-based practice and QI. Research-based practice promotes better patient outcomes. Research is the generation of new knowledge and helps us to understand the impact of what we do. Some examples are why should or should we not brush teeth while in the hospital? What's the best solution for feeding tubes? How do we know when and when not to ambulate patients? So then, what is evidence-based practice? Evidence-based practice is the conscientious use of current best evidence instead of tradition in making decisions about patient care. It's a problem-solving approach to clinical practice that integrates the best available research, clinical expertise, so your clinical expertise, and patient preferences. And quality, the definition of quality often depends on who the stakeholder is. The stakeholders are, as the name implies, people with some stake or concern in the process. So quality improvement is a formal approach to the analysis of performance and systematic efforts to improve it. There are numerous models. These models I'm sure you've heard of. The focus, analyze, develop, execute, plan, do, check, act, Six Sigma or diametics, total quality management, continuous quality improvement. There's probably more that we have not listed here, but these are models of ways that you can improve quality, and they're all forms of an ongoing effort to make performance better.
This is a schematic or a table that just gives you a visual overview of how these three initiatives are distinct, yet they have some similarities. In terms of purpose, research, as we said, is to generate new knowledge. Quality improvement really looks at internal processes, and evidence-based practices it's focusing on improving patient outcomes. So if you look through the components of this table, the designs may differ slightly, subject selections may be slightly different, and then your results are going to be a little bit different. Many of these initiatives, well, I shouldn't say many, but for research and evidence-based practice projects, that's highly encouraged to run through your organizational IRB, Investigational Review Board, and so that you can publish or disseminate your findings. For quality improvement, if it's an internal initiative, oftentimes it does not require an IRB.
One other thing I'd like to point out is sometimes it's difficult. You have a difficult time determining should it be research, quality improvement, or evidence-based practice. And one way is to think about how you'd like to use the information in the end. And so if you look at this in research, it's presented and available to others. Quality improvement is used by a specific institution or organization, and evidence-based practice is using evidence to apply to the practice that you are involved in, or you or others are involved in. So that's another way to help you that I find helpful anyway.
So how are research and evidence-based practice instrumental for quality improvement? Research uses defined methods to answer questions or problems, and evidence-based practice uses the research findings along with nurse and patient input to guide decision, action, and interventions and policies. And oftentimes, evidence-based practice and research projects originate from a quality initiative. So these are kind of all tied together, and therefore not mutually exclusive. So the steps for quality improvement: how do you want to solve problems? The key step is asking or looking at the clinical setting and asking the right question. What is the problem? Do you have a problem of patient falls on your unit? The next thing you want to do is perhaps look at the relevant literature, which we will go into talking about in future programs. Then you want to be able to evaluate the evidence. Just because something is published, don't assume that it is the best information available. You have to have the skills to critically appraise and evaluate what you're reading. And then you want to be able to choose process changes based on valid evidence. And of course, with any quality improvement initiative, you want to evaluate the outcomes. So to further go into the steps for quality improvement initiatives, define your question or the aim of the quality improvement process that you are expecting to change. Outline a project design or strategy for changing. How do you plan to reach those aims or to answer your question? Explain, you have to be able to explain the changes that are made in order to achieve your improvement. Oftentimes it may be helpful to present this in a graphical representation of the improvement. You may want to do trend charts or other graphics. You want to indicate the changes that are being tested and how they are being adapted to your unit or institution. Also, consider multiple measures to really hone in and look at the improvement. So just don't rely on one source or one measurement. With any clinical improvement initiative, it's usually a multidisciplinary team that is pulled together and involved in looking at processes. So, for example, going back to looking at falls on your unit, who all would be involved? It may be nursing, it may be physical therapy, it may be OT, there may be other staff and disciplines that would be involved. And then you want to be able to demonstrate sustainability of your change or your improvement. And then clearly to be just summarize or sum up by what was learned from this initiative or this change. And any of the models that we presented in the earlier slide can be used, but again, it may be something to consider what your question is and what unit is involved that may determine your model. Your organization may have a particular quality improvement model that is used.
So what are the steps for evidence-based practice? The most difficult first skill to learn is asking the question. What is the question, or what is the problem? That's the most difficult first step. And it's very important to determine the correct problem, because without knowing what the problem is, you don't know whether you've finally addressed it and solved the problem, or if that really is the root cause. So this is a nice schematic, I think, that helps you and me determine which route you're going to take. So if you start at the top in the little six-sided box there, it says available evidence. So if you have a problem that you determine your problem is patient falls. So the first thing you want to do is go look into the literature. And the question then is there any evidence, is there any literature about this problem? So if the answer to that question, which in this case would not be the answer, but in something else there's a likelihood you would not find any evidence, and then it moves over towards the box where it says no, that means then, because there is no available evidence, you or others need to do research to generate the information that serves as the evidence going forward. So generating new knowledge, if no knowledge is available, or if the knowledge in that area falls within a gap between two pieces of evidence for that, then research is what you would do. If, however, you have available evidence in the literature, and so therefore you move over on the side of yes, the next question is are we using the evidence in our practice? And if the answer to that question is yes, then probably what you need to look at is how can we evaluate if the way we are using the evidence is being used in the most appropriate and the best way. Or in other words, is there a problem or an issue with our processes that need to be addressed? So that would be a quality improvement project. If, however, you determine that no, we have this evidence, but it's not being used in our practice, then that is when you would look at using evidence-based practice change as the model for making changes in your patient practice. So there are commonly cited evidence-based practice models. Kern, Stetler, Iowa, Rostrum, and we'll talk about them just very briefly, each of them. First off, Kern. I had to include this in here because it was really the very first approach. Kern stands for, as you can see, conduct and utilization of research in nursing. In the early 70s, when I was just a youth and in the nursing programs, nurses were not at the forefront of research. Nurses looked at what had been used, traditional information, traditional ways of doing things as a way to decide what practice needed to occur. And you may have heard of diploma programs that had, if you went from one hospital-based diploma program and worked in a different hospital-based organization, then you might need to learn their way of doing whatever it was, whatever the procedure was, because it was very traditionally bound. But the Michigan Nurses Association in the early 70s was very foresightful and focused this Kern project on helping nurses translate or transition research into their practice settings. This was really kind of a radical approach. And the outcome from this project was a realization that just trying to take research and put it into practice was not the way to go. That practicing nurses would only use research if it was widely disseminated and relevant to their practice. So Curran is kind of the grandmother of these approaches. Nowadays, currently, there are other models. One is the Stettler model. And you can see here that in any of these models, the ones that we also will talk about in just a minute, I'll show in a minute, they have basically the same approaches. There's not a radically different way to address each of these models. But the key element of each model is what is the focus. So the Stettler model focuses on how individual nurses adopt research findings at the bedside. And it looks at what is the preparation, how do you validate, look at the comparative evaluation, decision making, translation and application, and then the evaluation. If you look at the Iowa model focuses on how an organization changes practice. So not at the individual nurse or at the individual patient level, but how does an organization say, we're going to change our practice, and how are we going to do that? This was originally a research utilization model, but the focus was modified because it was not the issue alone of research utilization. It was the issue of changing practice based on research and how it moves forward. So some of the kinds of questions that would help you determine whether you wanted to look at an organizational-based change or an individual-based change would be, is the topic an organizational priority? So if your organization has falls as a priority, is that something then that you would want to use the Iowa model to change? Does a sufficient research base exist? And is the change appropriate to adopt for practice within your organization? And the Ross-Rum-Larrabee model is one that is used widely within organizations and is focused on evidence-based practice. And it steps out, identifies the steps that need to be done to be able to implement evidence-based practice change within an organization.
So now that we've gone through some of the steps and models of evidence-based practice, let's talk about some of the commonly cited barriers that either prevent or inhibit a nurse or organization from implementing evidence-based practice and research. One of the key barriers is just the organizational culture. Is your organization an environment that has the adequate resources for research activities and evidence-based practice initiatives? Does the organization promote a culture for clinical inquiry? Are there expectations for staff to be engaged in EBP and research activities? Is that part of your annual review, or is it part of your leveling criteria? And what are the external forces requiring change? Another common barrier are nurses feel that they don't have the authority to change practice, that they aren't qualified, that they haven't had formal instruction about research, the skills for research, and evidence-based practice. They aren't necessarily comfortable with reading and critiquing and analyzing research, therefore why should they even try it?
And then one of my most favorite, and I had to quote this because to me this quotation represents research-related barriers in relation to statistical information. So in the book Schmidt and Brown, they state that research-related barriers can be complex statistical information and dense research jargon pose barriers to knowledge diffusion to most practicing nurses. Or, translated into English, some of the barriers that nurses put up in front of themselves is, as Beth mentioned earlier, that they think, well, I just don't understand the research project, I don't understand the research jargon, and on top of that, don't even ask me to have to do any kind of statistics. And we, over the course of these modules, will help you understand better the dense research jargon that is not necessarily needing to be dense, and also give you basic statistical information, as well as talk about how you work as a team. This is not you alone doing this. You need to bring in others, including statisticians, including people who understand some of the research jargon.
I think this last barrier about not having enough time for nurses and being too busy with patient care is probably one of the top cited barriers in the literature, and it's truly evident as we are is time allocation is really being watched and scrutinized. The non-patient hours are being looked at, and nurses don't have the time to do that clinical inquiry and work on research and evidence-based practice projects because they're busy with direct patient care. And again, that brings back to the earlier barrier where we talk about that organizational environment. Are you in an organization that supports clinical inquiry? So how do you move towards an evidence-based practice project? As we've been saying over and over, it really begins with a clinical problem, a patient question, and then searching for the evidence. So we want to present PICO, which is a method of putting together a search strategy and coming up with your question. So PICO stands for what is the patient or population that you want to look at, the who or what, and what is your intervention, what is the how are you going to make a change, and then what is the comparison, do you have an alternative if it's appropriate, and what outcome are you trying to accomplish. So what are the steps for implementation? Again, asking the question, identifying the issue or problem, looking for the evidence, and we're going to be talking about how you search for the literature for recent and relevant research and best practice. And then being able to evaluate the evidence. Again, using those critical skills to evaluate what is published in the literature, and then choosing and applying interventions based on the most valid evidence that's available, and evaluating outcomes. This last slide, again, is the PICO format that helps you put down or hone in on your question in identifying the problem, intervention, and comparison. And what group and outcomes do you want to look at? So let's say you do want to look at a specific population that is prone for falls. So maybe people with cognitive challenges. What would be an intervention, fall prevention strategies, and maybe you want to compare this this vulnerable population with another population, and what is the outcome is looking at fall rates. That's just one example. Okay, so this concludes our first module that is really just an introduction to research evidence-based practice and quality improvement. And hopefully you can see that while there are many similarities, there are distinct differences, in particular with what is the outcome that you're looking for.
We look forward to seeing you at Module 2. Bye.
Okay, so this final slide of the PICO format, or the PICO, however you want to pronounce it, helps you to lay out, again, as you're defining your question and looking at the problem, intervention, and comparison and outcome. This is just a way for you to put down your patient or problem. So let's say, for example, your problem is increased falls with patients who, neuro patients who are cognitively impaired. And you may want to look at an intervention using mechanical techniques, and a comparative group would be those neuro patients who are not cognitively impaired. And then your outcome would be looking at fall rates. That's just an illustration of how you can use this format and compose your problem question.
Okay, so this is the end of Module 1, and we've given you an overview of evidence-based practice, research, and quality improvement. And now, moving into the next modules, we'll be delving more deeply into the various aspects of these, and we look forward to seeing you at Module 2. Thank you.
Thank you.